Hi, good afternoon, and thank you for taking my call. I
Happy to do
appreciate
it.
it. I know, Doc, you answered this question earlier about premature ejaculation
All right.
for low-dose Prozac.
Yeah, Prozac, low dose Prozac. Okay.
Yeah, but the reason I'm calling is I'm a little bit, I don't know if the person that asked this question is like me, but I'm a little more complicated. I'm taking medication for diabetes, blood pressure, and cholesterol.
All right. Okay, and
So I don't know if it's the same thing will work.
Okay, well, oddly enough, it's safe for diabetics. It's safe for folks with cardiovascular disease. Prozac itself is a wonderful medication, and when used in low dosage, it will slow things up. Okay. Now there are other things that you need to look at with regards to the diabetes and the cholesterol in particular, and that's to make sure that you too do not have thyroid issues. Because when people are hypothyroid, their blood pressure goes up, their blood sugar goes up, and their cholesterol goes up. Okay, so it's not sufficient to go ahead and check and make sure that you have a normal TSH. Okay, you need to make sure that you don't have autoimmune thyroid disease, and also to understand that hormones don't work individually. Okay, they work like pack dogs. Okay, so they operate and they modulate effect in a cell at the genetic level. They pass through the cell, with the exception of insulin, actually. They pass through the cell membrane, pass through the nuclear membrane, and trigger a gene to fire. Okay, but it may take 2, 3, or 10 hormones to be present at the same time at the same place in order for this to occur. So if you have a thyroid issue, if your thyroid is inadequate, okay, that's one thing. But if your testosterone's too low, you're going to become functionally hypothyroid. If your estrogen's too low and you need estrogen, or too high, it will not work. The same thing is true of cortisol, DHEA, androstenedione, dione, parathormone, and a bunch of other hormones. They do more than one thing. So what do I think about the Prozac in you? I think it would be safe because, after all, you still need to attend to business, okay? But I would be more inclined to be checking you upside down and sideways to make sure that there's not a problem that hasn't been sorted out yet.